Hi, I'm Dr. Kelly Starrett at the Ready State. I want to talk about how we use the H-wave in our practice and with our athletes in both sort of acute settings and in long-term care. Underlying both of those situations of, is this safe to use long-term? Is it safe to use a lot? And the answer is unequivocally yes. When we have an athlete coming out of trauma or surgery, one of the things that we try to do is get the athlete to use the H-wave as much as possible. What we find is that keeping the limb sort of constantly contracting in this very non-fatiguing, very comfortable contraction allows us to keep the tissues integrated into the brain, so we don't see a lot of inhibition. We don't have to reclaim those quads or those sleepy tissues after sort of immobilization. We're able to protect the tissues and have no motion but get a lot of movement in the thing we're trying to load. And simultaneously, what that ends up doing is it allows us to continually manage congestion and constantly bring fresh blood flow into these areas. So we shoot for 20 out of 24 hours a day of low frequency pumping. Now, to be clear, if we just had an episode in the morning of 30 to 60 minutes, maybe we got one more episode in the middle of the day and a nice little pumping session at night, that would be amazing because we're able to stay ahead of the congestion. Remember that congestion and swelling, which is a normal part of the inflammatory cascade in the healing process, can easily sensitize and be a large driver of discomfort and pain, but simultaneously that congestion, same congestion, can also limit healing. So number one, we try to use it a ton until we really start to feel like we're ahead. And clinically, we find, for example, that we try to be ahead of most swelling in something like a simple ACL reconstruction within 12 hours, which is pretty remarkable. Second use case is ongoing. And what we find is that after surgery or big joint replacements, we might have swelling that's normal to loading those tissues for upwards of 18 months. And so what's great about having the H-wave is that we can use it in this acute setting, but we know that it does not lose its effectiveness or efficacy months down the line. And what ends up happening now is that when we overdo it on a tissue that's repaired or through trauma, we suddenly have on-demand pain relief and we can continue to manage that congestion. Most people are discharged from physical therapy and sort of good luck, return to sport, and they show back up and their tissues are highly congested because they don't have a strategy. Additionally, what we see is that the more use we have, the more the tissue ends up staying connected to the brain. And so we're able to manage sort of sometimes the inhibition that happens with normal loading and post-exercise or post-loading swelling. So we don't have to battle this tug of war of how do we reclaim or get these tissues sort of reactivated. So again, in the acute, we try to pump at least 3 times a day or 20 or 24 hours for my maniacs. And in long-term care, we find that it does not lose its efficacy. In fact, we give our athletes a way to manage their pain if that happens as part of their normal healing process and a way of staying ahead of swelling and managing congestion in the long term as those tissues normalize.